Live from the KGO TV Broadcast Center, this is ABC 7 News.
Well, the debate on whether the Affordable Care Act is a success or not will likely continue for years to come.
But one local hospital says because of Obamacare and other federal and state cuts, it might not be around to see the results.
ABC 7 News I-Team reporter Dan Noyes is here now with the unintentional side effect of health care reform.
Well, Carolyn and Dan, St. Rose Hospital in Hayward has had money troubles for years. In fact, it has almost closed before. Its patients are mostly uninsured or underinsured. And just as a new management team is making headway to keep the hospital open, the reductions in federal and state money might mean those doors shut for good. For patients like Ginny Allman, St. Rose Hospital's location in Hayward is everything. She was recently rushed there for emergency surgery, and she says a few years ago, St. Rose doctors saved her life after she almost died in a fire.
Very grateful that they were there and so close to where I live.
The private nonprofit hospital sees almost 35,000 emergency room patients a year. With Kaiser Hayward closing, St. Rose will be the only facility receiving 911 patients in the Bay Area's fifth largest city. Now, St. Rose might have to shut down.
It'd be tragic for myself and for the neighborhood.
If St. Rose is no longer existing, that means lives are at stake because ambulances have to travel a little bit further ways to another facility.
Roger Chrisman is St. Rose's chief financial officer. He says as a safety net hospital, St. Rose sees large numbers of uninsured and underinsured patients. The fees those patients can't pay have been subsidized by federal and state programs such as Medicare and Medi-Cal. The Affordable Care Act will reduce Medicare subsidies by $22 billion over the next 5 years. The idea is that more people will be insured and able to afford health care. But Chrisman points out his hospital still needs that money because St. Rose serves a poor community, many of whom might not sign up for insurance.
We will receive $3.6 million less in reimbursement for the next 12 months.
Add that to the $10,000 deficit Chrisman says St. Rose racks up every day, in part because Medi-Cal doesn't cover full-service costs.
Under the Medi-Cal program, we're reimbursed approximately 13 cents on the dollar.
The states and the feds are basically doing what's good for them without realizing how much they're hurting these individual community hospitals.
Steve Russo is a healthcare industry consultant. He says the cuts will hurt more because St. Rose is not affiliated with a larger group, such as Kaiser, Sutter, or even a county.
It's very hard to offshoot this because they're not part of a system. They don't have the purchasing power of a large system.
We tried to talk to state and federal officials about the unintended consequences of the Affordable Care Act, possibly shutting down hospitals such as St. Rose that are already experiencing problems, but they either pass this on to someone else or decline to be interviewed. The California Department of Health Care Services did send an email that reads in part, "We value the services provided by our provider partners like St. Rose, and we are committed to ensure access to services for our Medi-Cal members." Alameda County is another part of the equation.
St. Rose has said to us at the county for years, like, oh, you got to do more, you got to do more.
Alex Briscoe, director of Alameda County Healthcare Services, points out taxpayers have supported St. Rose to the tune of $40 million over the last 5 years, an amount he says was appropriate because of the important role St. Rose plays in the county.
St. Rose not only faces the challenge of not getting enough money, but they also face the challenge of serving a community that is increasingly living in multi-generational poverty.
In a letter to Alameda County Supervisor Wilma Chan, St. Rose is asking for $18.3 million each year to help cover the $3.6 million in reimbursement cuts and other funding needs. Briscoe says $18.3 million isn't realistic.
I think an augmentation of somewhere between $4 and $6 million is probably the right level of support.
I think the supervisors of Alameda County are very fair individuals, and I'm certain that they will do everything in their power to help St. Rose Hospital.
Ginny Allman hopes that solution comes soon and St. Rose doesn't have to close.
Well, they've saved my life. I might want them to do it again.
The health care reform reductions are not one-time cuts. Each year, hospitals such as St. Rose will get fewer federal and state dollars. So there needs to be a long-term solution worked out if St. Rose is going to survive.
Long road ahead, obviously.
Absolutely, years and years.
Thanks, Tim.